All right, hello Lexington. My name is Kevin Hall. I'm the communications officer here at the Lexington-Fayette County Health Department, and we appreciate you joining us again for this important Facebook conversation. Now, this is a Facebook Live, but maybe we put quotation marks around the live because we are filming this on Wednesday afternoon because of some technology issues, but we'll be broadcasting it as live Thursday at 2 p.m. so we can answer some of the questions perhaps in the comments. But just because you don't see us answering the questions as we're going through this talk doesn't mean we're not listening. We also can answer some of those questions in future Facebook conversations. This is the second one we've had. It will not be the last. So before we get going, I want to say, take some time right now to tag some people who would be interested in this. Share it with people. Anybody that you think would be interested in learning more about COVID-19, especially as it affects African Americans in Lexington. What we are seeing is this conversation we started last week is we're looking at COVID-19 and race, especially because it's disproportionately affecting African Americans, not only in Lexington, but in other cities in the US. What that means, disproportionate is we have, based on our population rate, we have more cases than what you would expect. As of April 15th, there are 212 confirmed cases of COVID-19 in Lexington, with 29% of those in African Americans. If you look at Lexington's population, the African American rate is about 15%. So we're going to talk about that trend. We also want to talk about mental health. That came up last week. One of our participants, Board Chair Kacy Bryant, was talking about how we can overcome that stigma with mental health and how important that is that people reach out and stay connected and focus on their mental health in addition to their actual physical health and that public health. I said this last week, and it's important to repeat this. This isn't designed to solve the problem. That's not what we're doing here today. What we aren't here to say, we're going to blame underlying health conditions and let that be a blanket that covers everything. We understand that that's one of the reasons that's being given. But we want to talk about the root causes that can lead to those conditions and have an honest talk about COVID-19, about race, about health equity, with a hope of improving outreach of important public health information. This isn't the last time we're going to talk about it, as I've said, so keep an eye out here at facebook.com/LFCHD. Today we are joined by some very special guests. We again have Kacy Bryant, board chair and a public health official and a nurse. So she's the board chair of the Lexington-Fayette County Board of Health. We have Shambra Mulder, a PhD and licensed psychologist. We have Dashawn Freeman, director of prevention at New Vista, and John Broadus, youth empowerment specialist at New Vista. So we welcome everyone to this panel. Before we get started, this is very sad, been a sad week for many of us here in public health. Divine Karama, who was participated in this first panel, on Monday he shared that one of his daughters died in a car accident, and Divine has been a tremendous supporter of public health and outreach in our naloxone campaign to reverse opioid overdoses, and now he had started the talk and discussion with outreach with COVID-19. And so for those of you who watched last week, or those of you in Lexington who know Divine, it's been very sad, it's very tragic, and our thoughts are with him and his family, and want to let him know that we are keeping that conversation going, that he has helped start last week, and we are doing that for him, and we are doing that for his family and for all the families out there in Lexington. So Divine, we're thinking about you, and I'm really sorry to hear the news. Want to start today's conversation with, again, going into one of the things we talked about last week. We're going to talk about this every week. It's what are some of the barriers that African Americans in Lexington are facing when it comes to COVID-19. Shambra, let's start off with you, if that's okay. And if you want to do a quick introduction of yourself to the people watching, and then tell us what are some of the barriers that are being faced.
Okay, so I am a licensed psychologist. I was recently doing counseling and therapy in private practice, but in February, I was appointed by the governor to work with the Cabinet for Health and Family Services in the Office of the Ombudsman. And so in part of that role, I'm part of the response to COVID-19 on behalf of the state in terms of some of the services we provide in the cabinet. But just some of the, hopefully I'll be able to talk about some of the barriers and issues I had as a private practitioner who, you know, took Medicaid and saw people in Lexington, and also on the other hand of being a government official.
Okay, well, go ahead and let's start and let us know what were some of those barriers in private practice that you did see firsthand of African Americans with COVID-19.
Well, not specifically with COVID-19,
mental health.
but in terms of mental health and being a healthcare provider, some of the policies and legislation in place. For example, Medicaid is for a lot of people who can't afford private healthcare. We know that there's a problem with people accessing Medicaid, being able to qualify for Medicaid. But once you get Medicaid, what I found was it was just the beginning. In terms of mental health, what access do we really have? You know, as a PhD level psychologist, I know that many of my colleagues will not take Medicaid for two reasons. The first reason is the rate of payment is low. Mm-hmm. And the second reason is that it was very difficult to get the payment. The process of billing and fighting with the insurance companies, as a provider, you know, certainly, you know, people have that, you know, how do I get pre-approved for particular procedures? How do I get medications paid for? And all of those things that providers just don't have the time to wrestle with. And in terms of medical cares, you know, large agencies that take Medicaid, I'm sure the rate is lower, but also they have to hire people, an entire team, almost like a team of lawyers, to fight with Medicaid to get the payment. So I think that there's policies there in terms of, so it's not an easy fix as let's get people signed up for Medicaid. That is just the beginning of the battle for a lot of people. And then there's just legislation in place. You know, for example, in terms of criminalization, Senator Neal put a bill that will look at the race impact of some of the legislation that was coming across related to the criminal justice system. That bill hasn't been heard. It's been maybe 3 years, but that's just in that system. But we also need to look at the racial impact of a lot of other legislation that we put in place, including healthcare. So one of the conversations going to be, you know, there are policies and practices in place that prevent people who really want to access services. And then we have to look at the quality of those services. And, you know, when you think about marginalized population, there's a reason why we call them marginalized. They're in the margins. So those are the people that are going to get the least or have the least. And oftentimes we as agencies have to have a special plan in place to make sure that we reach out and get to those marginalized communities.
And that's hopefully one of the things that moving forward that we can work together on, and how we can do some of that outreach to make sure that, because those are going to be people who are some of the most vulnerable in Lexington, and making sure that they have what is needed to, not only with COVID-19, but moving forward with general health issues as we move past COVID-19. And that is, we will get past COVID-19. It may be a while, but we can start this with this conversation and go further later. John, let's talk with you. We'll do a quick introduction, but same thing to you. What are some of the barriers that what you are seeing that African Americans in Lexington are facing when it comes to COVID-19?
Hello, everyone. So my name is Broadus. I'm a youth empowerment specialist for New Vista. And so I primarily work with youth, and I do youth-focused prevention, so substance abuse prevention, mental health awareness. I think from my experiences and my interactions, I think one of the biggest barriers is the stigma that we still have in many of our African-American communities regarding mental health. And I think that, you know, for many of us, the idea of talking about issues outside the home is still very taboo. And so as a people, faith is a huge component of our culture. And so we take everything to the altar. And so issues that are apparent within your family or within your own life, you take it to God. And I think we have to do a better job of connecting Christianity and our faith with treatment. And I don't think we do a great job with that at times. And so I think many times when we look at mental health issues, it's always the worst. And so it's that person who's talking to themselves. And we also see some of the language we use, which is very stigmatizing. So, we say, such and such is special, or such and such ain't right. Or we say, bless his heart. And so some of the languages, we don't want to be referred as that. We don't want to be referred to as special. Because special has a negative connotation. And so, or you not right has a negative connotation. And I think for many people, for many individuals in minority communities, it's the fear of labeling. Because that's a historical problem, is that we've always been labeled. And so because we face labels throughout our entire lifespan, we don't want to have another label. And so the way in which I escape those labels is I keep those things to myself. I think that's one of those issues that we see within many of our communities, especially in our urban communities. Like I said, it's that fear of someone knowing I have problems going on, someone knowing that I have these issues.
Well, I mentioned that yesterday we talked with members of the clergy and pastoral groups here in Lexington. So hopefully that's one of the connections that we can work on. We're providing them information weekly about how to reach their congregation. With the mental health things that you were talking about there. So that could be something we could work on together moving forward. Sean, let's take it over to you. Same questions. Some of the barriers that you're seeing that African Americans are facing with COVID-19 healthcare. It can be historic, it can be current, it can be what are you seeing, and what's on your mind to talk about?
Hi, I'm Dashawn Freeman.
Sorry.
No problem. Hi, I'm Dashawn Freeman. I am the Director of Prevention at New Vista. And I would just say more on a personal level. I think a lot of times, besides Dr. Shambra, there's not many doctors or therapists or counselors of color whatsoever. So I feel as though a lot of times people feel more comfortable with people who look like them, resemble them, can automatically relate. And it's something about when you see someone across from you and you're sharing your problems with them, if they look similar to you, you feel as though they can put themselves in your own shoes and can better relate. And a lot of times that's not who they're seeing. So when they're sitting across from somebody who doesn't resemble them automatically, it's a disconnect, it's shutting down. And so I think that's a lot of the things. Beyond what John and Dr. Shambra said, it's the stigma, but it's also just having somebody, once you make it to that next step, you can go to a counseling service, but if they're not looking like you and you don't feel that connection with them, you're done. And it doesn't help the issue at hand. So that's been my observation when it comes to mental health.
All right, Kacy, if you want to give just a quick introduction and talk a little bit about, maybe expand on what you said last week, or maybe some things that have come up in the last week that you would like to talk about with some of the barriers.
Yes, so I am the Board of Health Chair, and I am a public health nurse by trade, as well as faculty of nursing at the University of Kentucky. And so this was a great segue into this week's conversation, and I'm going to say it again like I did last week. I just don't feel like we're necessarily taking care of our mental health during these times, and not just for adults, but also for our children. And like I believe Sean's got some kids. I don't know about Dr. Shambra and John, but having our kids at home, this is a crisis for them. This is a crisis for all of them, and acknowledging it, as John said, we often in our culture do not want to acknowledge those mental health issues, those emotional issues. And so I do want to make sure that in all of our conversations that we're not only thinking about taking care of ourselves, but we're also thinking about our kids too, who may be having signs of anxiety or stress, or because this, for them, their whole lives have been turned upside down. Our lives have been turned upside down. And so we don't want to forget them in that conversation as well. They are that subpopulation, right, of our culture that we don't want to make sure we don't want to overlook them at all.
And if I could add on to what Ms. Bryant was saying, and I think it's really important we recognize too, is that for many of our youth that are living in environments that are toxic, they don't have a lot of protective factors. Mm-hmm. And so the lack of socialization with school peers or with teachers or with school psychologists at school could be their only opportunity to have that positive interaction with an adult. And so we have to take into account that the loss of those protective factors and the impact it's having on the developing brain it's something that it's hard for us to sometimes to fathom, because school is that safe place for a lot of youth. And being able to get out of the home is something that many youth, they have to have, because they don't have it at home. And I think that when we look at pandemics such as this, we sometimes overlook the importance of having those protective factors, having that safe place, because youth don't have that safe place in times like this.
And is there anything that you're aware of that is being done to address that in Lexington right now? Or if somebody is in an unsafe place, what can they do?
Well, I'll say two things. The public school, Fayette County Public Schools, is doing a great job of trying to reach out to students. I know a lot of times we believe they have access to computers and the internet. You know, I know they're providing meals, which also puts them in contact with children. I think they're working on how, I know my son's school is, they're sending out emails, they're saying, please connect with us. Please connect with us if you need these services, because they're still working, they're still in school. Yeah. And so I think the public school is doing a great job in terms of children. What we find in Child Protective Services, that a lot of those referrals came from schools because they had access to students and they were able to do that. That particular part of DCBS is still available. You can still make those kind of calls if you're aware. Again, if you're in the home or not in the home, you don't know what's really going on in the home at this time. So it is a very real concern that children do not have access to someone who can protect them if they are in situations where they're not getting their needs met. Yes. So yeah, that is a great concern. It's probably something that keeps a lot of us up at night. The idea that children are at risk, and there's not a lot of people who are aware of what is necessary to make the kind of calls that need to be made.
One of the things that John had mentioned he would like to talk about as we got in this discussion is the impact poverty is having on this issue. John, do you want to expand on that a little bit more, the role of poverty and the impact of poverty as it pertains to COVID-19?
Absolutely. So I was looking at some data for Fayette County, and the poverty rate for African Americans in Fayette County is 34%.
What was that number?
34%.
34?
34%. So essentially 1/3 of African Americans in Fayette County living at or below the poverty level. And so, you know, growing up, one of the things that I always heard was, I can't afford to get sick. Right? That was something my aunt always said. You know, it was her and me. And if she got sick and couldn't work, how are we going to survive? And I think that's one of the issues when we look at the COVID-19 impact on African Americans. It's the idea that many of these homes have one primary breadwinner, whether it's a mother or father or grandmother or aunt or uncle. And so if they miss work, how are they going to survive? And so we say, well, you can file for unemployment. I hear many people say they're not getting their unemployment quick enough. Some people are saying it's taking 3-4 weeks. And those who have savings funds, they're gone. And so you at some point you have to take the risk that if I miss work, how is my family going to survive? And I think for many of our parents, with parents and grandparents within our communities, it's the fear that although I maybe experiencing some symptoms, I'm not sick. And you know, sick time, vacation time, these are commodities for the working poor. And so it's not easy to take off from work, because if you use that time up, you won't have the time for your children. You won't have the time for your grandchildren if they get sick, if something happens to you.
Can I ask you a question? And this is me asking you for help. So I'm the person who goes on Facebook and TV to say, if you're sick, stay home. Now we do want people who have these symptoms to stay home. But what can we say to the people who are in the roles and situations you just said? They cannot stay home because of the financial impact. How can I improve that message to reach people?
I think the most important thing we can do is to educate people on how to protect yourself when you go out of the home, how to properly put gloves on, how to properly take gloves off, how to properly put a mask on. You know, I used to work in the restaurant industry, and one of the trainings was an infectious disease training, and we talked about PPE. So you had to learn how to take a glove off and put a glove on. You got to learn the process of which you take the glove off, when you should take the gown off, when you should take the mask off. I think many people don't know that. You know, the idea of the glove on, you think, well, I'm okay. Actually, the glove is dirtier than the hand, because you have the idea that if I have the glove on, I'm okay. And so you do the same things with the glove on that you would do with the hand, but the difference is when your hands are dirty, you want to wash them. When the glove is dirty, you don't have that same thought. And so you'll see people wear gloves and they'll do the same thing as if they didn't have gloves on.
Well, I'll add that, you know, we talk about the shortage of PPE and how scarce that is, but I would also go back to policies. A lot of people are saying, first of all, they're being told they can't take their sick leave that they actually have earned. That's a problem. The next thing is FMLA. So how are companies and agencies making sure that people can get paid leave, maybe
Absolutely.
sometimes not use their sick leave and their vacation because they need to be paid, but they also don't need to be at work infecting other people. So again, unions are something that a lot of people don't have, but the people that do have people that advocate for them. And then we have the union people that can go in and say, this is not about one person or this particular person, because we don't, you know, people still have privacy and confidentiality, and you don't want to single out anyone, but these are overarching policies that can go out and make people believe that my company cares about me, that if I get sick, it will not come back and bite me later.
Absolutely. Absolutely. I think about Amazon, you know, a company like that, they bring people in left and right. Imagine if you have to take off work, there's a fear that I'll be replaced. And so I can't leave work because my productivity keeps my job. It keeps food on the table. And because you don't have those protections built in, as Dr. Mulder said, then, you know, you're not as willing to really take your health serious.
You even do the same thing when it comes to your children and you're a single parent. You realize that you might not have the child care available. So you're like, let me hurry up and give them a Tylenol to break this fever so they can go on to school so I can go on to work, because you don't have that safety net.
Kacy, anything that you want to jump in on?
Well, I just, as I've said before, when I just go back to culturally, you know, we are part of that "it takes a village" mind frame. And I'm going to keep saying this, our village from a face-to-face standpoint has been taken away from us. I mean, we can FaceTime, we can Zoom meet, we can Facebook meet, whatever. But when you're talking about, I'm used to taking my children over to Aunt Niecy's house, right, for childcare, and now I'm not supposed to. What is my decision? Do I take them over there and risk my aunt, my grandmother, their health, my children's health, or do I go to work and make this money? What do I do? Those are the decisions that a lot of parents are having to face. And you're right, Dr. Shambra, I don't know if necessarily all the policies are there to promote people being able to stay at home the way that we want them to.
Absolutely.
Is that something, and I don't know the answer to this, is that something that part of the governor's hotline is for? Is that been addressed at that level? If you're in a workplace that you feel unsafe, is that something that they can call the KY Safer line?
They could. They could call the line. You know, I will say that a lot of companies that I am personally attached with have made policies available for people that if they are feeling ill or if they are having childcare issues, that they can at least have some type of protection in for their job.
Yes.
So that is a good thing. My job at least is protected. Now let's talk about, but it's not just about the job. Now we're talking about let's keep our pay as well. That's the other part of it. Yes, thank you for letting me keep my job. Now I need my pay as well. And you're right, we do have the unemployment, mine's leaving my brain right now, the unemployment insurance, which is great. They've increased the amount of weekly payments. They've also increased who is eligible for the unemployment. And so those have been some positive changes. Great if they stay around after COVID, right? But those have been some positive changes.
Question that came up, and I will apologize. I'm going to switch like the rest of the panelists. Dr. Mulder, before I go any further though, does anybody else have a title that they need to go by? I want to respect the titles. So if there's anything else, if I'm, and this wasn't at her request, but I do want to, if I'd spent the years getting a PhD, an MD, or any level of it, you best believe people would call me that. So I mean no disrespect. But Dr. Mulder, one of the things that you said in our email conversation was you want to talk about the importance of being culturally responsive and the need for more cultural bias training. Would you like to address that for our viewers?
Well, you know, the time for saying we need more minority providers is just not going to fix it, you know, in terms of the people that are getting into school to coming out of school, being able to provide those services is a sort of a long-term conversation that a lot of us don't have a lot of control over. You know, it goes back to the achievement gap and people being able to get the PhD to become a provider. So one of the things that I've done, you know, I've worked with other organizations that have training. The training is not adequate a lot of times because it's volunteer, it's online, it's not really follow up on in terms of implementation. I know that some organizations don't have policies in place that can hold people accountable if they are, you know, practicing discrimination and inequities. And so personally, I'm a part of the Kentucky Psychological Association on the board. And what I've done as an individual provider is asked Senator Reggie Thomas, to sponsor a bill. This bill is on the books now. Don't know if it'll be heard, but that multicultural diversity training becomes a required training for mental health providers, psychologists, social workers, just like we have to take suicide training, we have to take training on domestic violence. And so there is some pushback, I'm sure, on this idea that everybody should be doing multicultural training. Of course, we're not talking about just race. We're talking about race, gender, and all the other sort of groups that fall under the civil rights protection. So what we want people to do is not only attend these trainings because they're required, but become more culturally responsive in terms of acknowledging people's cultural difference, being knowledgeable about how to interact with them as a result of their cultural diversity, and being more comfortable with the idea that what we learned in school all of those years might need to be tweaked a little bit. We do things a little bit different. It is not necessarily unethical or quote unquote best practices. What's best for the client and what's going to get the results that we need. Sometimes we just need to have more conversations about that. But the first thing we have to do, we just have to acknowledge that, you know, I may be inadequate because I really don't understand your culture. For example, if I'm a heterosexual person and I have a homosexual person, I'm going to respect that that is something that is important to them and that I need to educate myself, not think that it's their responsibility to educate me or to acknowledge that. I'm going to come in, I do trauma focused care. And one of the things we do with trauma is that we have them to define what's been traumatic in their life and how do I move from that space. And so culturally diversity training to me is a no-brainer. Some people see it as, okay, this is something else I have to do. This is not necessary, but we all have culture. We all have differences and things that mean things to us. And I just think that we just have to be open to the idea that maybe we need some more information about this to work with people more effectively.
I think that's a really important part of public health because of health equity and recognizing that we don't all start from the same place and that there are individual barriers for everyone. and working to acknowledge those barriers and those difficulties to provide the equal access to care. So yes, starting at that with some of that training would be very important. It is important for people, not just in mental health. But I want to now, for the last half of this conversation, talk about mental health as it relates to COVID-19. Sean, let's start with you. We've let you stay quiet up there for a little bit. What do you see as the role of mental health and why that's so important as we move through COVID-19? I'd like to remind the people watching, we're not even 6 weeks into this thing so far. And if you're like me, I don't know what day it is. I honestly sometimes can't remember. It's snowing outside, so is it really even April? I'm stressed. I'm having vivid dreams that others are having. I'm having those nightmares, those anxiety-riddled dreams. So using that, why is it so important to focus on mental health and to have those discussions?
I think mental health is always relevant to have, and I think that culturally, we're always taking care of other people and we forget the importance of taking care of ourselves. And as we are going through these times where we are isolated and removed from people and not being able to interact, and our whole world has turned upside downward. Some people may have lost their jobs. Some people may not know when their job is going to open up. It's just a lot of uncertainty. During that time, it is time for self-reflection. It's time for you to not view this as the end all and be all of everything. It's time to reflect. It's time to rethink and maybe reinvent yourself during these times. During these times, don't look at it as pure isolation. Everyone and anyone is all in this together. I think a lot of times mentally you feel like it's just you, but there is other people out here if you need them. It's a phone call, it's a text, it's anything, reaching out to just people you may not have talked to in a while, just to let them know, hey, I thought of you. Simple little gestures of the day helps improve people's mental health. Also taking this opportunity to do something as simple as movement. I've had a lot of dance parties in the house during this time. Because I'm like, I don't know what to do. Can't go out, but I'm gonna dance it out. I've walked more than I've ever walked before, just getting out, seeing people, seeing them at a distance, social distance, but still seeing them has helped tremendously. So I think just taking this time to reflect, but also just reflection on maybe there's a class you wanted to take. Maybe this is time to enroll and do online class. There are many opportunities, and I just want people to take care of themselves, be safe, keep the social distance. But if you want to have a dance party, go ahead. There's lots of people tearing it up on Instagram and everything else. They got live DJs if you want it. They're there. Just take the time to take care of yourself and look at the positive.
Dr. Mulder, same question to you. What do you see as being the importance of the role of mental health during COVID-19?
I think we have to listen to people. And also we have to recognize that a lot of people's mental health was not adequate or healthy prior to COVID-19. So this is an additional trauma when people are already dealing with trauma. I think if you're watching the news all day and you're bombarded with all of these messages, for example, I remember in 9/11, when we were watching on television, the planes going into the building. That was an event that sort of ended in a short period of time, but we were all watching it. That's traumatic. But now what we're doing, we're watching, we're counting the deaths. It's a lot of painful information being put out. A lot of it's not personal, but it becomes personal because now it just reminds us more and more of how fragile life is. And so for us, we have to pay attention and maybe reach out to people that we are aware that their mental health capacity, their resiliency was not necessarily there prior to COVID-19. And so we can't wait a lot of times for people to reach out to us. We've got to do some of the reaching out, and we've got to just recognize and just remind people that they matter. I think what we're finding out in this time is how much value we put on certain groups of people. You hear a lot about this is just affecting, people over 65, 70, but they're not expendable, right? They're still people. They're still our family members. everybody matters, right? And so I know we want to be quick about getting back to quote unquote normal, getting out of the house and all of those things, but we have to be very careful and planful about how we're going to transition people back to something new, because we'll be dealing with this for a long time, the mental health effects of this event, because it's traumatic, over time. Not even when you get your unemployment check, or even when you go back to work. We're all going to remember this time, and we're all going to be afraid for a while, even once we get out. And just be aware that everybody is not where they need to be anyway to sort of deal with this particular event. And so with mental health, I would like to see a lot of us plan and be more mindful about how we're going to make mental health more accessible to people. And if I go back to policy again, in order to get paid for insurance, you have to have a diagnosis. So we're going to put a label on you, right? A lot of times people are not aware of what the label is, but we have to, in terms to bill insurance, we have to have a diagnosis. And we have, and policy says that it has to be a clinical relationship for us to even really be in quote unquote therapy. But a lot of times, some of those sort of workshops and programs that we can have where we're not identifying people, we're not saying you have a mental health disorder, because that's not important. The services are important. It doesn't matter what the label is and what degree that particular mental health professional has and all of those things that used to matter before. So how can we make mental health information more accessible to people?
All right. John, before we have you tackle the question, I want to follow up on something Dr. Mulder mentioned that's so important about that. We talk about the people that are most at high risk of this, and we use a lot of numbers, we use a lot of data, and I always try to remind people that those are real people on the other end of those numbers. That is somebody's loved one who's affected by this, that the 7 deaths that we have had are 7 people who are important to people in Lexington. And so when those of you watching this, or you're listening in the background, when you hear us talk about the rates and the numbers, never lose sight that we understand that those are real people. And that's why we have these discussions, is because we don't want other families to be affected by this. So never think that we are just focused on those numbers. We're not. We use the numbers to be able to address what's happening in the real homes. So having said that, John, what do you see as the role of mental health, or any tips, or maybe you have dance parties as well? What are you seeing?
I think this is an opportunity for us to really start to get out services such as youth mental health first aid, making those virtual. And so we know social media has a detrimental impact on mental health related issues, but social media can also have a positive impact. And so we utilize social media as a way to sort of break the stigma that's placed upon mental health. And so instead of talking about the negative aspects of these things, we can talk about coping skills. We can talk about what are effective ways to cope. So helping you recognize, the power of walking, the power of having a dance party, how to, if you are starting to feel overwhelmed based upon all the news that you see on television, cut the TV off and listen to music. Recognize that there are things you do in your life that make you feel good, that are positive. So if you like to sing, or if you like to dance, if you like to clean, if you like to wash the dishes, if you like to cook, if you like to read. And so it's helping you identify, find those times throughout the day in which you can take for yourself. So practicing mindfulness, because mindfulness is hard to practice. As a parent, I have 2 boys, and my youngest son is with me every day because daycare is closed. And my older son, he gets to go to the Y, but there are some days when I'm here alone with him, and it can be overwhelming for me. And so I always try to make sure that at the end of the night, I take a couple minutes to myself to help me just to de-stress, to help me to, just to calm down and deal with my own mental health. Because I know if I don't, I'm not only hurting myself, but I'm hurting the ones I care about, because I'm not giving them my all. And so it's taking that time to yourself. And it's okay. It's okay to be selfish when it comes to your mental health. It's funny okay to practice mindfulness.
See, it's funny that you mentioned the dishes, because after the first week of the response to COVID-19, I don't like doing dishes, but I did them and it felt wonderful because I told my wife it felt a little bit of normalcy to be doing the dishes, and just having that of where the first week in our response, I didn't have time at night to clean, to work on cleaning. So it is find what you can to take that little bit of break. I'm going to keep it with you, John, because you've mentioned the stigma. Tell our viewers a little bit about what the stigma of mental health treatment among African Americans. You talked earlier a little bit about that. Is there anything you want to expand on some of that stigma?
Well, I think like Dr. Mulder had mentioned, the lack of cultural competency within the areas of treatment. Implicit and explicit bias issues are a huge factor in why a lot of African Americans don't always seek that treatment. It's the fear of talking to someone who doesn't understand me. You're not from where I'm from. The ideas of it's not what you say, it's how you say it, and not talking over people. And I think one of the things I've experienced in my professional life and academic life is that sometimes in academia we talk above people. And so, for instance, like with data, there's the idea that the average person doesn't understand data. And so I look at numbers and that doesn't resonate to me. We don't live based upon numbers, but numbers drives, how we address these issues. But the average American, they care nothing about data. And so we have to talk to them at their level, but at the same time not being demeaning in talking to people. Because when you phrase things, you can also be very demeaning. And so it's having that cultural, that looking at things from that cultural lens. So understanding that there's a certain way in which African Americans communicate. There's a certain way in which you can say things that I might not take it the way you meant. I saw that when I worked for the juvenile justice system. I had coworkers that would tell parents to call the police on their sons. Well, she couldn't tell that mom to do that because she wasn't from the same cultural background. Because the mom looked at her as at the idea like, you're trying to get my son hurt. Now I can say that and say, okay, I understand. And so it's looking at things from that cultural lens that I need to rephrase or reframe how I'm saying these things so that we can have that conversation. And I think that's something that we all can practice. We can all practice looking at things from a cultural lens. So, taking yourself away from it and really looking at your life from your perspective, and you allow me to do that. And so I'm not trying to tell you what to do. I'm trying to help you to do the things that you need to do, but I'm never trying to tell you that you need to do this. I'm not trying to tell you that because you're African American, you're disproportionately impacted by COVID-19. There are certain things you can do that can save you and keep you from contracting this pandemic. So if you wear your gloves, if you wash your hands, if you wear your mask, if you limit your contact, that can keep you from being a part of that statistic. But I'm not going to tell you that because you're Black, you better watch out. Well, you're demeaning me. You're labeling me. And so, I think there's a certain way in which we say things that we really have to be mindful of, especially when we're dealing with people, with African Americans, because that's a historical thing for us. We've always had to deal with those labels. We've always had to deal with someone telling us what we need to do, telling us what our problem is, telling us what our issues are, but offering no solutions. And we have to be solution oriented when it comes to this problem.
All right, Sean, I want to take the same thing to you. What are some of the stigmas that you see attached with mental health treatment among African Americans?
John has talked a lot about the labeling. I think it's also just even recognizing a lot of times, I believe I had heard, you guys can correct me if I'm wrong, that it takes, I think, up to 7 years for a person to even realize that they're even depressed. I think a lot of times it's just the lack of knowledge but yet we're taught to persevere. And being a parent, you don't ever want to show your signs of weakness. You always want to make it seem, because your kids have so much expectations of you, and you have expectations of yourself. You expect that you're able to take care of the household and pay the bills and come to work, and if they're in activities, still make it through activities. And so I think a lot of times mentally you're like, I can't afford to break. I have to do this. So I will say that one thing, working now at a mental health institute like New Vista, this telehealth is something that I was not even consciously aware of, but I do think it's nice that in this situation that there's still resources out there that people can actually call and still get some type of assistance, but I just don't think it's out there, that people even know about that or even feel comfortable doing that, because I agree. Typically people just don't feel comfortable telling other people their problems. And it is traditionally, you go to church, you pray about it. Your family, you'll talk to such and such because they had a similar situation. So they probably are a guru of what you're going through. And it's no clear-cut help necessarily, but it's traditionally and culturally what we have been doing for several years and persevering. So in order for our race, I believe, to keep maintaining and keep moving forward, it's just a traditional thing. And we're like, we persevered this far. How is this any different? And I think it's the same thing with COVID-19. I don't think that, we've persevered. So I think they're always looking at us, we've made it through. This is something else. We'll make it through. And it's different. It's very different.
One of the things you mentioned was the telehealth, and that's something that Dr. Mulder had shown an interest in discussing both in our offline conversations, but also she's mentioned it here today. So moving forward, you've all mentioned that it's not only the immediate response, it's the days, the weeks, the months, the years after this that we're going to keep responding to. Dr. Mulder, if you could start things off talking about how can you see some improvement in the coordination of efforts for the increased and continued telehealth tools for Lexington and Kentucky?
Okay, let me mention something with what you guys were talking about before in terms of interacting with African Americans. As a provider, you want to build rapport and you want to validate people. So we need to come from a strength model and in a positive model of what they're doing correctly, as opposed to always talking about what needs to change or what's a negative. And I think a lot of people, in terms of policies and practices, some people believe if I really told you all the things that I go through, you'll probably lock me up. You know what I mean? You'll probably send me straight to the mental health institution. And so a lot of times when we're talking as an African-American person, you're talking about all of the things that you're going through. It sounds like a lot. And as a provider, you feel for them and you say, okay, this person needs to be hospitalized. But you haven't recognized that this person has been persevering. This person has a lot of strengths, a lot of protective factors, as John said. And so a lot of times when you're dealing with people, don't come from a deficit model and thinking that because I'm poor, because I come from this neighborhood, that I don't have a lot of strengths. Now, in terms of telehealth, I think telehealth has been sort of around, but not necessarily used. I think there's some uneasiness about confidentiality in terms of the tool that you use, some issues with whether people have access to the tools that you want to use in terms of Wi-Fi again and the computer. And a lot of times insurance has been a barrier. They may not have wanted to pay for telehealth. And so what we're seeing now is a lot of the relaxed rules because, telehealth is all we have. And a lot of organizations like New Vista and hospitals are liking it because you don't have a lot of no-shows, right? You can call them and on their own time and make it more convenient. Sometimes it might be outside of those 8 hours or the 3 hours that you had time to see them in the office. So it is flexible. It's always been available, but I think the rules have made it such that it is more acceptable now. And I think, again, we have to be very cognizant of make it comfortable for the person. If I don't want to get on a video, can we just talk on the phone? Especially if you've established a relationship, you're talking to the right person and you can assure confidentiality, which means you're not doing it at the coffee shop or, somewhere where people can necessarily hear what I'm talking about. And so we just have to be, come from the client perspective of what they're comfortable with, because we definitely want to make the connection. It could be as easy as, okay, I don't have an hour to talk, but I really would like to talk to you. Can I do it for 30 minutes? And, in the past, we only do 45 minutes and you have to stay the entire 45 minutes. So we're going to have to be more flexible as providers. And I like this idea of telehealth. I hope it continues because I think though even some of our organizations now that we're working at home, they probably are seeing more productivity. And so we've got to change how we think about things as a result of COVID-19.
Before we wrap things up, we've got about 10 minutes left, and I want to get your all's last message to our viewers. One of the things that you mentioned, Dr. Mulder, was the focus on the strengths. And if just real quickly, maybe I don't even know if we can spend 30 seconds each on it, but maybe you just want to email me privately. I'd like your help on focusing on those strengths and some of the outreach efforts. One of the things that came up last week when we did this talk, and it was not the intention, but when some news media outlets shared this, some of the comments I saw is that, well, it's not only African Americans who aren't washing their hands. We're not saying that. We are never saying that you're doing something wrong. It's not a tisk from the health department. It is looking at the numbers and saying there is a problem here. How can we reach you to help us keep you alive? That's what we want. We want to keep you alive. So do you have any thoughts, I'm going to throw it out to the panel, whoever wants to answer, on how we can focus on those strengths to say, we hear you, and here's what you're doing well, let's keep that going on with COVID-19.
Well, I'll go first.
Okay.
The first thing would be, how are you making this information testing, the results available to the community where, for example, Kroger is now doing testing? Okay, well, we know that there's a lot of food deserts in African-American communities, and the Kroger is not necessarily accessible. And so is there a van that could come to the community center in the neighborhood to do this testing? And so I think what people were saying was there are some things that we can do differently, but there's some things, some organizations and policy that you can do differently to meet us halfway.
And something that you asked, and Kacy, would you want to address this? The question, Dr. Mulder, you sent me through email was, is there data being collected or shared on the racial disparities in testing? Because that is just as important as who is testing positive or dying due to COVID-19 as a first step to investigate inequities. Kacy, do you want to address that?
Right. And so the various testing facilities, whether it's some type of Kroger-like facility or a hospital or a private medical office, they do not have to report to us who they tested or how many people they tested or their racial background. And so we do obviously know when there are positive cases, and then we can then assess race, age, ethnicity, race, and that kind of thing. But we do not get that data. And so, testing is limited. So there is going to be a bias towards sicker patients, people who are showing those symptoms, that fever, that severe cough, that shortness of breath. And so unfortunately, we don't have data on everybody who has been tested. We do know that obviously those who are tested are the ones who are going to be in that sicker range. And we do know, regardless of the data breakdown of who's being tested, it's still unfortunately been disproportionately present in our African American community.
All right. For those who didn't get a chance to answer, email me, stay in touch, please. And this won't be, because again, this is not the only avenue we have for this conversation, and won't be the last time you'll get called on to come on here to talk about this, because we appreciate you taking the time for this. As we wrap up, and if you can, in 60 seconds or less, what's the one message that you want to leave the people watching this today? It can be about mental health. It can be about COVID-19. It can be about barriers. It can be about the best way to do a dance-off, if that's what you need. Because I'm afraid you're all going to ask us to dance as we close this up. Maybe that's what
dance challenge.
We'll start. Sean, let's start with you. What's your message to the people watching?
I actually think that one of the things I wanted to touch upon, and real quick, and brainstorming as we've been talking and things, and thank you, Ms. Bryant, and Kevin for explaining to me about the mask and the importance of wearing the mask and everything like that. So I was thinking in my mind, as we've been talking, that it'd be really cool if the health department actually did like maybe mini tutorials and have something for the kids to design little masks. So show them all the different things they can use in their house to create masks.
That's a great idea.
And maybe show it to the kids, and the kids can make it for their household members. I mean, that's just what I thought of. I don't know if that was a message, but I like it.
I like that idea too. I'm writing it down. We have some of our communications staff who have kids at home who are, they're teleworking. So this might be a perfect assignment for them on looking around the house, things you can find to be able to do that. Thank you for that idea. Dr. Mulder, let's go with you. 60 seconds. What's your one message you want to leave people with?
Well, I would say that the only person that was able to feed 500 people or 5,000 people with 2 fishes and loaves of bread is Jesus.
Right.
So we do have a scarcity of resources. Therefore, it's only natural for people in the margin to be forgotten. So what we need is some organizations like yourself to apply for the funding to actually do some ground level research of people, African-American people that have been tested, so that we know that being African-American doesn't mean you were going to get positive. So what were some of the things that may have gone wrong to why they may have gotten sicker or died more? For example, if I know that this person tested positive, can you tell me how you were treated when you went to the hospital? How did the testing go? How did the treatment go? And so those are kind of questions, some ground level qualitative research that is going to be necessary, because we're not going to be able to move forward. We understood that there were going to be populations of people that are forgotten. That's nothing new. What we need to know is why.
All right. Thank you very much. John, same question. Your message to our viewers.
So I would just say that I think as African Americans, it's important to realize that we are not statistics. We are more than statistics. And although statistics are saying that we are disproportionately being impacted by COVID-19, there are things we can do to protect ourselves. I know that social distancing may be something that we may not be able to practice right now. We may not be able to stay home because of our jobs. We may have to go and see our parents. And so it's important that as we continue to live our lives, just practice those safe hygienic practices. So if you don't have gloves, wash your hands as much as you can. If you don't have a mask, if there's any type of cloth, any type of anything at home that you can put over your face, please do so. You know, I know that like Dr. Mulder said, you know, there's a scarcity of resources, and it takes money to buy these things. And so whatever you have at your disposal, use it to protect yourself, because we want to see this ended sooner than later.
All right, thank you, Kacy. What message do you?
I'm just very appreciative of the professionals that have joined us today. I mean, even though as a health department, we do not provide mental health services, we definitely are in the business of keeping Lexington well. And part of that is that mental health, which is how what I mentioned last week. And so we will continue to partner with our mental health institutions, organizations, professionals in the community to address the mental health concerns of our population.
All right. Thank you, Kacy. To all of our panelists, thank you for spending an hour of your day helping reach out to all of Lexington on this. Our mission is helping Lexington be well, and you all have done a great job in doing that. For those of you watching, thank you for your time. We hope that you will leave comments and maybe some ideas, some topics you'd like to see us cover on future conversations. If you know people who would be interested in this or you would like to hear from, let us know, reach out, because we built this today based on feedback we got from last week, and that's how we're going to keep moving forward. Again, thank you all to each of our panelists. This has been very, very important. It is not, I can't stress this enough. It's not the last time we're going to do this. So please reach out to me, reach out to Kacy, reach out to anyone here at the health department when you have something you want us to talk about. Lexington, thank you so much for allowing us this time to talk about this. We will continue to have this important conversation because we want to protect all of Lexington. We protect all 350,000 people. It's the people on the margins, the people outside those margins, and everywhere in between. So Dr. Mulder, thank you for putting a highlight on that. Keep watching Lexington. We want to have these conversations with you weekly. Thank you to the mayor for facilitating this, for Laura Hatfield for getting this going, and Andrea James for your role in getting these people connected with us to talk about it today. Thank you again. We'll talk to you soon, Lexington.
Thank you.
Bye.
Thank you.